I wasn't getting out of bed.
I wasn't going to work.
I hid my problems from everyone.
I didn't want people to judge me.
I watched my daughter suffering.
I didn't know what to do.
Because you joined the conversation, we know we are not alone.
We are not weak.
We are not ashamed.
We are strong.
And help is out there. We need to ask for it. Join the conversation. Visit letstalkstigma.org.
Hello, I'm Frank Cammarata, Executive Director of the Erie County Office for People with Disabilities and Board Member of the Erie County Anti-Stigma Coalition. On behalf of the Coalition, as we continue to celebrate our 5th anniversary of anti-stigma advocacy, I would like to welcome you to our 14th Facebook Live event, another great opportunity to meet with experts in the field and discuss timely concerns. This time, we are focusing on the state of stigma and how tragic events impact our mental health. Most importantly, we want to focus on the basics and discuss why it is okay to seek help. For the past 2.5 years, the world has experienced a pandemic of epic proportions, not seen since 1918. Some have experienced the effects. Others have been on the front lines assisting or treating people affected. We have witnessed an invasion of Ukraine by Russian forces. We have seen increased gun violence on the streets and in our communities. According to Gun Violence Archive and NBC Analysis, over 200 days into 2022, and there have been an average of 13 mass shootings a week. A mass shooting is defined as an event where a minimum of 4 victims are shot, either injured or killed, but not the shooter. There have been 417 mass shootings in 2022 so far. And let us not forget the 10 victims of the top shooting event on May 14th in our own city of Buffalo. We have had a great deal of trauma in a short time period. What do we do with this trauma? Should I reach out for help? How? To whom? I'm joined by some wonderful professionals today to discuss those questions. Before I introduce our panelists, just a couple of housekeeping rules. Our program is 1 hour. During this time, if you have a question or comment, please type it in the chat box and we will respond accordingly. Your questions and input often lead to terrific dialogue. So please don't be shy. There's no such thing as a silly question, as we are all here to learn today. Now it gives me great pleasure to introduce our panelists. Melinda DuBois was named Executive Director of Mental Health Advocates of Western New York in September 2020. She has over 25 years of experience managing multidisciplinary health and human service organizations, is a well-respected administrator with a reputation for building relationships and coalitions, and has served as an advocate in Albany and Washington, D.C. Before MHA, Melinda was Vice President of Health Services at Planned Parenthood of Central and Western New York. She was Administrative Director of Student Health and Counseling at SUNY Geneseo, Executive Director of Buffalo Women's Services, and a Clinical Coordinator at Baker Victory Services. Melinda is a graduate of State University of New York with a Bachelor's degree of Arts in Psychology and Master's in Social Work. She resides in East Aurora, New York with her husband, daughter, and her black lab, Yoshi. Welcome, Melinda.
Thank you so much for having me, Frank.
We also have Laura Kelemen, who is the Director of Niagara County's Department of Mental Health and Substance Abuse Services. She is a licensed clinical social worker with more than 25 years' experience. Ms. Kelemen's clinical work has focused on assisting youth, families, and adults who have been impacted by physical and sexual trauma and neglect, as well as substance abuse and mental health recovery. In her current role, she oversees a range of county-operated programs, including outpatient, crisis, and hospital diversion services, and is engaged in system planning, program, and policy development at the local, regional, and state levels to facilitate people's access to needed programs and supports. Welcome, Laura.
Thank you, guys. Great to be here.
And we have Rochelle Morrison, who is the Director of the 24-hour Suicide Prevention and Addictions Hotline at Suicide Prevention and Crisis Services in Western New York. Ms. Morrison leads a team of professional hotline counselors and is the overseer of the implementation of the suicide hotline, the clinic after-hours behavioral health continuum of care program for over 12 behavioral health agencies, the Chautauqua County Adult Mental Health Hotline, the 988 Lifeline, the Kids Line, and the newly added 911 Diversion Program. Ms. Morrison is PhD pending in leadership and public administration, holds her master's degree in mental health counseling, and earned her baccalaureate degree in human services from the University of Buffalo. Ms. Morrison is also co-owner of Renewed Me and facilitates wellness conferences and trainings throughout our community, abroad and in the faith-based community. Welcome, Rochelle.
Thank you, Frank. Thanks for having me.
Thanks for joining us. Thanks so much for joining us today. We're going to go right into the questions, if you don't mind. And my first question is, define trauma, considering all the recent local events such as the May 14th top shooting and what people have experienced. Why is it so hard right now? Whoever wants to start, please feel free.
So I'll jump in. So I think that a really good basic definition is an emotional response to a terrible event. So trauma can show up in lots of different ways for people. It can affect relationships. It can affect your ability to function. You may have flashbacks. There's just lots of ways that trauma can manifest in a person. But I think it's really important to think of trauma as an actual, it's not a flaw or something that's wrong with you. It's actually your body's way of protecting yourself. So it's an adaptive response. So many times when we think about trauma and traumatic events, we think about them in the negative. And I think it's important to realize that really our body is working hard to protect ourselves, to find ways to stay safe during a terrible event.
Well, and so,
Rochelle?
yeah, so Frank, you brought up in your introduction something that I think is really important. You ask, why is it so hard right now? We've been dealing with in our community and, across the globe, the COVID-19 pandemic for 2 years now. And that the pandemic created for many of us, most of us, an elevated stress level. For a couple of years, there was this threat to our health that we couldn't see. And for quite a period of time, we had very little information about that threat itself. So we've been kind of, and our social networks and our schools and our work have been somewhat disrupted relative to coping with or protecting ourselves from risks related to COVID-19. And when you're already at a very elevated stress level, the things that are happening that you mentioned, the shooting in Buffalo, the war in Ukraine, all of those things, we're already having challenges with normal coping or with coping with challenging situations. So when you have a traumatic event, our emotional coping capabilities are already pretty much stressed to the max. So it is hard. And I think that for people to recognize and give themselves permission to almost realize why the things that are occurring right now might have us reacting more strongly than previously we may have. These events are traumatic, but recognizing why it's so challenging, I think, is really important for people. We're constantly right now, when is the next shoe going to drop? And it's important to give ourselves permission to understand and feel that.
And
but not stay there for too long.
If I can add along with that is, Melinda might have mentioned it, but if not, if you add mental health on top of it already, all the things that Laura just described and Melinda, and you add on mental health issues, financial issues, health issues, and top that over all these local events, then of course you can kind of see if the access to these more of these resources we're going to talk about later on makes it even harder. And that's why it seems to be at this point, people are kind of at a breaking point. And Laura hit it on the head with coming out of COVID. We all had to find different ways to cope. And with all these other things on top of us, makes it really hard.
Okay. All right. Laura, do you think, I mean, this should probably be a pretty easy question, but does everyone experience traumatic events the same?
No. And I think that it has a lot to do with, for some people, it's upbringing. For some people, it's their family's experience of previous histories of trauma. There is such a thing as intergenerational trauma. Rochelle pointed out, if you're already living in a situation where you've got economic uncertainty, other safety concerns, your response to a traumatic event will naturally be different.
Okay.
Yeah, Frank, I wanted to add on exactly what Laura said, but also there's a term called adverse childhood events, which some people may have heard ACEs. And that is the events that have happened to us in our childhood that we, of course, had no responsibility for or control over. And for some of us, those events have added up, so many of us have had maybe 4 or 5 adverse childhood events. So we're already, when we get to adulthood, already carrying a lot of stress and anxiety around our the places around us that are safe. So adverse childhood events could be your parents were divorced, or you witnessed violence in your family or in your neighborhood, or somebody that you loved died. So when you have all those childhood traumatic events happen to you, then when something like the shooting happens or something tragic in your life happens as an adult, think about it, you're carrying all of those additional traumatic events. So sometimes I think about how when a tragedy happens, like the shooting, for some of us, it brings up all the past traumas in our life. So we're dealing with the current traumatic event as well as all of the past traumatic events. Sometimes when you lose somebody you love, you think about the other people that you've lost in your life. And so it feels like it's a piling on or an adding on. So I think that makes it extra challenging.
Yeah, and that's that vicarious trauma we're going to talk about a little bit going. I don't want to jump too much ahead, but that's exactly where I was really headed to and to discuss, because along with that, everything that Melinda just experienced, it's the everyday living that these things will also bring up too. The massacre will also bring up the everyday living, and then you pile what happened maybe when you were younger, or like she said, something in your family, something traumatic happens, that pile up is that vicariousness in it all. And it definitely makes it very, very tough for some folks to be able to handle a traumatic event the same as someone else.
So Rochelle, we talk about abuse, we talk about, people who've gone through divorces, et cetera. So many of these different, traumatic events, why are we different in our approaches to living with that trauma?
We're different in our approaches because I mentioned a little bit earlier of the resources, and also your background, your history, where you live in the city that you live in our community. The approaches are totally different because of the part of the community of the city of Buffalo that was directly affected from the massacre. Their experiences have been so different, and they're in the middle of how are we going to go get groceries? It changed everything about their everyday living that I mentioned, and then now they can't approach this type of trauma the same way you would any other trauma because it is so magnified. The massacre touched so many different areas of that community and of our community that you become kind of, you see some people walking around like, I just don't know what to do. Where do I go first? And even though you have folks reaching out to you, you have to start to internalize your space in this whole thing. And that makes the difference in how some people are able to approach it. And some people are able to just say, I'm just going to black this out, and I'm going to handle this a little bit differently. It may be too tough for a lot of folks.
Yeah, I would add to that, and what Rochelle brings up is really, we've lost communities and people's sense of safety has been shaken. So the assumption that I should be able to go get groceries, I should be able to go to my house of worship, I should be able to put my kids on a school bus and go to school and have that inherent sense of safety that people, at the end of the day, everything's going to be okay. And so that sense of safety has been disrupted. So people really then have to start thinking about, where am I going to go? How am I going to go there? Am I going to be safe when I try to go about my daily business? And that's a challenge for a lot of people. Some people are able to be emotional or process those challenges. Other people, sometimes it's based on upbringing, sometimes it's based on personality, want to just sort of sweep that under the rug and say, oh, it's fine, it's going to be fine. But if those worries don't get processed, they can't get addressed. They don't just go away.
Yeah, you know what, I was thinking about that, Laura. I also wonder about this kind of concern that people feel like there's a sense of weakness. If there's a traumatic event that happens, or something really difficult that happens in a person's life, if they're not coping well, is that a sign of weakness? And so, just kind of this idea that, you just have to push through, you just got to continue to go on, I'm strong enough to handle something like this, really works against us, because it's not a sign of weakness. It really is, when you're struggling with a traumatic event, it's for a lot of people, a universal experience. It is a normal, like I said, a normal adaptive response to something that's terrifying or horrific. And we don't have really good coping skills to deal with something that dramatic. So seeking help and reaching out to your support systems is really more important than ever. And I just want to reassure people that it's not a sign of weakness at all. It's a sign of strength when you can ask for help when you really need help.
So Melinda, and I'm going to jump ahead on one of Frank's questions because I think I know what's coming. Thank you for setting me up so beautifully with that. I really do believe that along the way, many of us have internalized that there is a stigma about seeking help for mental health and substance use concerns. And many people have internalized that stigma. They carry that themselves, feeling that if they ask for help, it's a sign of weakness. Y'all can probably see a few weeks back, I fractured my hand. I was out for a run. I fell. I knew right away there was a break. I went and sought help at an urgent care to, get this taken care of. So there's a physiological issue that happened with me. I thought I didn't think, wow, other people have it worse than me. Someone got into a car accident today, so I don't want to go get help for myself. I thought, you know what, I'm going to go get this taken care of, so I'll be okay in the long run. When we have an injury to our mental health, which often has a physiological component to it, a lot of people do say, well, other people have it worse off than me. I'm not going to go get help. Or I'm weak if I go call the doctor or go find a therapist. And well-being and good, healthy well-being involves both our physical well-being and our mental and emotional well-being. It's all one and the same. And so really hoping along the way that the message is it's okay to be healthy from both a physical perspective and a mental well-being, and seek out that help when you need it.
Laura, we have we actually have a question from one of our viewers. Is there a right way or a wrong way to process the mental, emotional traumas?
I can jump in. There is no right way or wrong way. I think that, and we've been talking about the traumas that you've already experienced as a person. And a point that I wanted to bring in that will actually go right with this question is, I think Laura mentioned your history, your upbringing. How does your family, as when you were raised, how does your family or your community deal with trauma, deal with things that happen in the community? What is your life experience in the community and how your family and your culture, how do they handle and how have you been taught? So it doesn't mean that because you were taught that way and that is the way that you should get yourself some help, move out of your comfort zone or how you were raised to get some help. But it definitely plays a big part in that you could sit back and say, wait a minute, for me, maybe this was tough in my family or in my culture, and start to think about what would be kind of best for you. How do you think you would be able to continue to move on? What are your aspirations for your life? And that will help you with being able to say, how can I reach out? Is this way right for me if it isn't right for someone else? So I hope that answers that. You have to dig inside and kind of bring it all together, your past, your present, where you want to go towards your future, and how you feel like for yourself, what's going to help you get past this.
Rochelle, you bring up such a good point too, when you say, there is no right or wrong way to process trauma, and family culture, history, those types of things are really important. And so when you're looking to reach out to somebody for help, oftentimes there is what would be a good personality fit or a good fit, whether it's spiritual counseling that you're seeking, because that's an important component in your world, or whether it's a therapist who has an understanding or can relate to your family history or your culture or whatever. I think the relationship that you can develop with your support system and or professionals who are going to help you can be really critical and important. And so to give yourself the ability to explore that and see what's helpful for you.
And you know what, Laura and Rochelle, we're talking about what we call the tools in our toolbox, right? So what's really difficult is that we know that the future is uncertain. And unfortunately, things like these tragic events continue to happen. But when we have a relationship with a spiritual leader or a therapist or a family member that we can really connect with, when we've figured out what tools really help us, the coping skills that we need, the things that really keep us healthy, when we add more tools to our toolbox, when something tragic happens, we're able to reach in and grab those tools. And so, I always say that I think counseling is a requirement for just the human condition. We should all engage in therapy at some time in our life. And that's partly because we're trying to establish those strong coping skills and tools so that when something terrible happens, because that's what life is about, things happen, we're able to grab one of those tools. We'll be able to use those things to help us stay healthy and to manage the struggles that we're managing. But it really is so important to know who you can reach out to. Certainly crisis services is a number that we always recommend, 834-3131. And people can also reach out to Mental Health Advocates of Western New York, our agency. You can call our number and we can get you in touch with a therapist, a counselor, a clinic, really any resource that you might need. So we have so many fabulous resources in our community, so much out there that is available, that sometimes it just takes one phone call in order to access all of those resources. And we're certainly talking about the Anti-Stigma Coalition, and a lot of what we're talking also about is this decreasing stigma. So when you're able to talk to somebody in your neighborhood, in your community about the struggles that you're having, that allows them to know that it's a safe space for them to talk about their struggles as well. So the more we can talk about what's happening to us individually, the more we're decreasing and destigmatizing the struggles that we're all having. So one of the most fabulous things that happened as a result of this tragedy that our community has dealt with is that we've had people come together in ways that I've never seen before in our community. One of those really wonderful things are healing circles. So having community members get together and heal together, finding community in different ways, so that you know that you're not alone in the struggles that you're having. So our community has really come together and shown its strength after this tragedy, and I'm really encouraged by that.
Melinda, you talk about reaching out to a therapist, to a service provider, but how does somebody find that right therapist, that right service provider? How do you make that connection? Because it's not easy, because you're almost creating a relationship, and you're giving kind of some secrets to your inner soul here. You're sharing that information, and that is certainly not an easy thing. How do you find that right person?
You're right. It's a really good question, because what you mentioned, Frank, is a relationship, and that's what a therapeutic. We call it a therapeutic relationship, because you are building a relationship with another human being, and it requires trust. And so reaching out and finding the right person sometimes can be challenging, because, luckily there's a lot of listings at MHA. We can help you with this. If you're looking for a therapist that deals with trauma or deals with sexual assault or eating disorders, lots of people have their specialties listed in the listings that are in the referral systems. But also, really most importantly, is that you feel comfortable with that person. And so if you reach out to somebody, a therapist, and you meet with them 1 or 2 times and you don't feel like there's a connection, you don't feel like that's a person you can trust, that doesn't mean that therapy isn't not right for you. What it means is you have to find another person. So it's very appropriate, and we encourage people all the time to connect with a therapist. If it's not the right person, find somebody else. And that sometimes means you can talk to a friend who sees a counselor and ask them who they're seeing and see if you can make an appointment with that person. So it's a really important relationship. So it's really important that you connect with your counselor.
If I could jump in and add that you try to find a counselor or a therapist that will listen to you. Listening is one of the skills that I have perfected over the years of on the hotline, because I had to be able to hear something we call affect, or hear what we don't hear or what the person doesn't say. And so if you can try a couple different times with a different counselor, that if you didn't like that one, then you can try again. Someone who's going to listen to you and be able to talk back to you in the same kind of language that you are speaking in, and can very shortly identify with some of your struggles and why you are seeking counseling. So you don't want to give up, but you don't want to stay in a counseling relationship or a therapeutic relationship with someone who you don't feel is not listening to you, or who cannot connect with you and the things that you are trying to do, who cannot connect with your culture, who cannot listen to you and learn your language, even if they are from a different culture. That is one of the biggest keys that I've found out, is you have to find someone who's willing to listen to you and not compare you to anyone else. We talk about empathy a lot on the line, and empathy is not sympathy or compassion. It is being able to sit and listen to someone and then say, okay, let me try and see how I connect with this person and what they're saying, and then mirror back to them exactly what they're saying so they can start to trust me, so they can feel safe when they're talking to me that, oh, she's paying attention to me and not generalizing. So that's something I think is just so important that we don't want to skip over. And as counselors and therapists, we sometimes feel like we have all the answers, or, we can go and do counseling or something for everybody. That's not really it. You want to find someone who can connect with you, who can hear you, so that you can help you grow.
Rochelle, as I'm hearing you, I'm also thinking, in addition to that, really, really critical points. Some people benefit also from more of a support group. So we're talking about professional counseling and professional therapy, which is really important for people who have ongoing mental health concerns, lingering effects of trauma. But I also don't want to dismiss the really critical importance of peer support, talking with other individuals who have similar lived experience, who have had their own experiences in developing coping skills and finding supports and developing a circle of people that they trust. Support groups for depression, anxiety, loss survivors exist. And again, mental health associations or our crisis services lines can provide that information to people on how to find those support groups. And in a support group, there might be 10 people, and you might end up developing a close connection with 2 or 3 of those individuals, and go out and have coffee afterwards and develop, those relationships that can in turn be healing for a person.
Yeah, Laura, I'm so glad that you brought that up, because the peer support is key. And many of our agencies hire actual peer advocates or peer specialists. At MHA, we have family peer advocates and youth peer advocates. And as you mentioned, those people have their own lived experience, and they use that lived experience to connect with other people so that they can provide that support and also help them link to services if those services are required. But it provides that really wonderful, what sometimes I talk about as wraparound support, right? So having a therapeutic relationship with a counselor is fabulous. Having peer advocates around you that have experienced the same thing that you've experienced is wonderful. And then also having, your family, your friends, those people who have shared that experience, those are those additional tools for your toolbox, right? All of that is required for support. In fact, there's also different kinds of therapies and different kinds of just movement, actually, for a lot of people who have experienced trauma. Talk therapy is important. Peer support is important. Having a community and that you feel supported in, and sometimes movement. I'm a yoga instructor, and I know that for many people, movement, dance, yoga are also modalities that really help people as they work through trauma. We know now that trauma sometimes lives in the cells in our bodies, in the tissues of our souls. And so being able to engage in some movement and paying attention to your breath can be really helpful for some people in conjunction with other therapies.
Thanks, Melinda. If anyone is just joining us, I'm Frank Cammarata from the Erie County Anti-Stigma Coalition. I'm joined by Melinda DuBois, who is the Executive Director of the Mental Health Advocates of Western New York, Laura Kelemen, who is Director of the Niagara County Department of Mental Health and Substance Abuse Services, and Rochelle Morrison, who is the Director of the 24-hour Crisis Counseling Program at Crisis Services. Today we are discussing trauma and how tragic events impact our mental health. Everyone joining us, please take a moment and check out our website, letstalkstigma.org, and maybe join nearly 4,000 others in taking the pledge to end stigma. Also, if you're connected with a business, organization, or faith community, you can become an organizational member of the Anti-Stigma Coalition. You can find information for this on the website under the Members tab. Now back to our panelists. Following the attack on author Salman Rushdie at the Chautauqua Institute, Eric Brady wrote in the Buffalo News on August the 15th, 2022, "If you love a place, to see the pain people are in right now, it's just too much. You feel violated. Unfortunately, this is the world we live in. It's everywhere." I want to touch upon vicarious trauma. We touched upon it a little bit before, but I want to touch upon it a little more. How this affects the caregivers. What is vicarious trauma? What can the caregivers do to help themselves and help other caregivers? Melinda, Rochelle?
If I could jump in,
Sure.
this is an area that we discuss a lot at Renewed Me, and it's the vicarious and the trauma. And so before Melinda jumps in, I just wanted to add that the quote that that person said, it is so poignant to our community right now. And the vicarious trauma that Buffalo has experienced with the massacre, and in that particular community lost Dr. Daniels, who was one of the 4 only African American or Black, how some folks say, pediatricians in Buffalo. And his office was right in the space where the massacre happened, in the same plaza on Jefferson is where his practice was, 2 doors down from the hospital. So the same community had just experienced that massacre and then experienced the loss of this very, very important figure. And what's so difficult for that, most likely for that community, is they lost pillars of the community. The massacre, the folks who were murdered in that massacre were pillars in the community. They were all grandmothers and church goers, church leaders, community leaders. And so when you have that type of a trauma built up on top of trauma, built up on top of the everyday living of that area, Laura mentioned earlier about safety, being in a safe neighborhood. It's crime in those same neighborhoods. So when you talk about all of those things that the neighborhood has happened, it's piled on top, is where you get that vicariousness in it. And the caregivers who are not just left, but who are now have to deal with some of the children or grandchildren or husbands or wives or fathers who were family members of those lost, now have to reach out to get a different type of resource, right? For a while, there wasn't a grocery store, and a lot of folks over there wouldn't even go to that. They're choosing not to go to that grocery store anymore because of how it brings up the traumatic events. And so when we talk about vicarious trauma is defined as a concept or dealing with how to handle life with those different tools like Melinda mentioned. How are you going to handle life now that you've realized you have all these different things we've mentioned piled up on top of trauma, on top of loss, on top of neglect, or on top of less resources? That's the vicarious when you add that to the word of trauma. So how can we as professionals help that community and our full community with these resources and being able to get folks to understand that vicarious trauma is a real thing, and it has to be picked away, and it has to be looked at very seriously, of all these separate components that Melinda mentioned earlier, from your childhood all the way up to this latest traumatic event. So when we want to step back and look at it in our community, and yes, unfortunately, it is everywhere in the world where we live at, but you can reach out and you can try to say, okay, I don't want to reach my tipping point because of all these vicarious traumas. And I want to be able to still continue to live and to survive and thrive and raise my family and help my family members who were left here from those that were massacred. you can do it. You can reach out, like Melinda said, to the hotline. The hotline will help you kind of pull out some of these different areas that you are piling up on top of each other and where we can start first to help you with healing.
Yeah, Rachel, such a strong impact on that community and a huge, huge loss. And I think when you talked about the massacre and then the death of Dr. Daniels and the pillars of the community, and that those are huge losses. And no wonder people are really hurting because, one of the things that I think is a struggle for people, Laura mentioned is, so your doctor, your pediatrician, the person that you trust, your community leader, somebody that you trust in your church is gone, your place where you go grocery shopping, the community where you feel safe. Tragedy is happening at our schools and in our workplaces, at the Institute. I grew up in Jamestown, New York, and Chautauqua Institution was always considered a kind of a safe, sacred space, and for a stabbing to occur in that space was really difficult. I think the other part, Rachel, when you're talking about just the vicarious trauma and it piling on and so many people being affected by these huge losses, I also think about vicarious trauma as being that trauma that people have by witnessing somebody else experiencing a trauma. So that could be doctors, that could be first responders, that could be journalists who are covering tragedy. That could be teachers who have kids in their school who have experienced tragedy. It's really all of us who have witnessed this really difficult experience that our community has experienced. We've all, unfortunately, for a while, there was a video of the shooting that was going around, and some of our young people saw that video, and that in itself is experiencing some vicarious trauma. But for us, it can be caregivers. It can be so you have somebody in your life that was at tops. You were not at tops, but you're watching that person struggle. That's vicarious trauma. I think the thing that sometimes is really difficult with vicarious trauma is people may question their feelings. Like, well, I wasn't really there. It didn't happen to me. So why am I struggling so much? Or, there's some guilt. Sometimes there's some guilt about feeling that trauma, or really having difficult times processing something that has happened. And for many people who are in the helping profession, like social workers and doctors and nurses and teachers, they think that they're supposed to just handle all of this. Like that's just the normal, they're just caregivers. That's what they do. They go to work every day and they manage people who are dealing with traumatic experiences. And so what I encourage people to know is that doesn't mean that you should go on without asking for help. It's very, very normal to have strong emotional responses to tragedy around us, especially if you're in the helping profession. Again, it shows a lot of strength if you're able to say, you know what, I'm really struggling here. I know that this didn't happen to me. I know this happened to my patient or the child in my classroom, but I'm also struggling and I need to reach out and get some help. I need to talk to somebody. It's really, really important that you do that.
Okay. I think we have a question from one of our listeners. For those of us who do not live in East Buffalo, how can we help? And what words or actions are not helpful?
Well, I can jump in again a little bit if I can. I was trying to wait. I don't want to overtalk Laura if she wanted to add into anything. This is a really good question, and some questions that I've heard a lot from folks who do not live in that community. what you can do is reach out to, I don't know who mentioned earlier, but like faith-based communities are a great place to start. Because no matter what your denomination is, most priests or pastors or, officials in faith-based leadership kind of know each other or know someone who can get in contact with someone else in the faith-based community to kind of see what that community, what those folks are actually coming to their to their leadership and asking. Renewed Me, you can also, peers was a very good option as well. Renewed Me, we actually did a training or like a listening session with some young folks who just were already seeking mental health services. But we kind of wanted to just extend it a little bit to talk to let them voice their concerns about the massacre. And out of that came what we're talking about right now, all the other things. And some of them were in the community and some of them were not. But all of the other things, crime in the city, or just how they've maybe lost their parents and were in the foster care system, all kinds of things came out of that. And one of the biggest questions that we posed to them is, how can we help you? It was paying attention to them and hearing their words. And what do they need from us to be heard? And a lot of the answers came back is, who's going to help us step outside of our community and of the things that have been happening in this community? Who are we going to go to make sure this doesn't happen again? What are our public officials or our leaderships going to do? How can we as young folks even have a voice? And it was simply, you just did. So what I would suggest too is reach out to your peers, see if anyone is going to any groups. Are they a part of any of these agencies? Do they ever call the hotline and reach out to try and get some different resources so that you can be the appropriate kind of help for folks who, for instance, if you are interested in the east side of Buffalo or around that area where the massacre happened, to ask, how could I help you? We didn't go into the session with any preconceived ideas on how we would help those folks. Again, that listening ear and trying to say, what do they need from us? And it was just listen to me, a place for me to come back to. Are you coming back? Renew Me. Are you going to really help us for our voices to be heard? And we committed to that. So for folks who are like us on this panel and you belong to different agencies or your own business or churches, what you can do is reach out to create some trainings or some venues for people to come out and listen and to learn your resources and to learn how you would be able to help them as a community. That's the way we're going to be able to support each other, no matter what community you live in, is reaching back and going out and listening versus being the agencies that we can sit back and kind of think like, oh, we've got our programs already going, we know how to help people. It's like, no, we need to go and listen. So reach out to some folks in your community that you are in your faith-based community, or if you know someone who's already seeking services, and then see how you can be a part of that, how you can be a part of an arm that reaches out for that.
Rochelle, so important. And the only thing I would say is by listening, by asking what you need, and by truly listening to the response, you are creating a safe space for those individuals. And it's in those safe spaces that people can heal. So critical, just the listening part.
Melinda, anything?
Yeah, I think one other thing I would add, so well put, both of you, is I think that the other way we can honor the victims, honestly, is by continuing the conversation. And that is, the fear that when all of the attention, the cameras, everybody that was kind of gathering in East Buffalo around the shooting, when all of those people are gone, the families are still there and the community is still there. And so in order to honor the tragedy and the victims, we have to continue to talk about what happened and continue to make that front and center and change our approach to things, change our policies, there is, when you have a crisis, there's always an opportunity for change in a crisis. And so we have this opportunity to make things different for our community. And there is no doubt that there's a lot of improvements that we can have there. You know, Rochelle, what you're talking about is there's so many people in the community talked about before the shooting, where was all this before the shooting? Where were all these resources? And so I think we have an opportunity to learn. We have an opportunity to learn and grow and be a better community as a result. But you're right, it really takes listening, not assuming what people need, but hearing clearly what they're asking for.
So believe it or not, time has gone by so quickly. We only have 10 minutes left. I probably only have time for one more question. And I want to kind of go along with that, the vicarious trauma, continuing along with that vicarious trauma piece. And we've touched upon other therapists, we've touched upon family members, and we've touched upon the difficulty of sharing the information, of getting people to go out and request help. But is there a good way to convince people to seek help? Is there a better way to convince people to seek help?
I want to say thank you, Frank, and for having this venue, because this is how. One of the things that Melinda just mentioned is when a crisis happens or a tragedy happens, right? You get everybody wants to be a part of everything, and you get flooded for a week or two or however long it takes for it to kind of die down and everybody move on to the next thing. So when this was a couple of months down, as we know, those of us who work with trauma, after 90 days, everybody kind of feels like you should be okay. But what about those folks who are not? And what about this type of situation in our community where there was a multiple loss that we have mentioned? And then added on, Dr. Daniels, rest in peace, is that we continue to have this conversation. We continue to be apart a month later, 2 months later, a year later, 2 years later, that we continue to have venues like this and others, that we continue to talk about this so that it isn't a forgotten thing that happened in May or in June or in July. We've committed at Crisis Services and Renewed Me with the youth group that I did speak about. I saw the question in there. We've committed to 2 years out. We're committed, and they waited. They wanted to see already, did we come back? And we are coming back. So that's how, and that's what we can do. Continue to have these venues, not let it be pushed under the table, put back all our stigmas on whichever community that crisis or tragedy happens. We're a full community, most of us, or a lot of us, born and raised in Western New York or East Coast or wherever you're from, committed to helping our community and advocating, being on the ground and doing this type of work. So again, thank you for this opportunity. And then for your viewers or just for community members or us professionals to continue to reach out and join again in another 30 days or another 3 months for this same type of conversation, to have these resources. And most folks like to be validated, right? No matter what part of your life in tragedy or not. And to come back in 6 months or a year later for another round of something like this, or whatever other agency you're with, to say, oh yeah, we do remember, we're still validating you. We still understand what you're going through. We still understand that there's going to be another one coming up, and this trauma may be a lot for you, but we're here. We're going to stay here and stick it out with you so that they don't feel forgotten.
Yeah, I think the other thing, Rochelle, is so important is that, Frank, you had asked about how to encourage people to get help as well. By giving opportunities like Rochelle's talking about, by giving, having forums and listening sessions and opportunities to seek help, that's really essential. As well as, one of the hardest things is if you know somebody's hurting and they're reluctant to get help. What we learn, especially with mental health first aid, is that sometimes you just have to sit with a person. Sometimes that, if you know that somebody is struggling, what that means is just reaching out to that person and sitting with them. talking with them on the phone, reaching out to them regularly, just creating that space and opportunity for them to know that you're there, even if they feel like nobody else is there. You're there, you're going to be there, 30 days, 60 days, 2 years, like Rachel says, you're going to be there and you're going to be able to provide that space. And when you can do that for another human being, you're giving them the opportunity to share what's bothering them. And also that there's trust, right? So you're building that trust for that person. And so sometimes we're so solution focused. Sometimes we're like, okay, this is what you need to do if you're struggling. Call this number, do this, do this, do this. And sometimes that's great and that's helpful. But sometimes it's just being a human being and sitting with a person and holding their hand and saying, that I'm with you while you're struggling.
I would just simply add to that as well that it can be really challenging for caregivers. Because again, Melinda, you said, sitting with people is really important. We want to be solution focused. If we're really, to Rochelle's point earlier, being empathetic and hearing people and listening and understanding where they're coming from, that can be that vicarious trauma that happens. And so for caregivers to also recognize the need to take care of themselves, to engage in whatever helps them and provides a sense of comfort and safety for themselves as well, whether it's talking to a support, going to a faith-based community, going for a run, doing yoga, movement, dance, whatever, just, as caregivers, reminding ourselves to take care of ourselves so that we are in a place and a space to create that circle of support for our community members.
Laura, I just wanted to add one more thing. Sorry, Frank, because I think it's really important because there's, like I mentioned, there's so many resources that are available in our communities. Crisis services and MHA. Another resource is on our website, mhawny.org. We have screening tools that are available. And so we even have one for PTSD. So if you're even wondering if you're struggling, you can go on our website and take a screening. And the screening tool is really effective because it'll help you understand what's going on and will encourage you to reach out for help if you need it. But sometimes people just kind of suffer in silence and keep what's happening internal. And it's so important to be able to reach out to somebody. We have these phenomenal resources in our community, and they're waiting for people that are struggling.
Well, Melinda, thank you so much. Laura, Rochelle, thank you so much. I have literally, I think, like 2 minutes left. If I could ask you to maybe wrap it up in a 10-word sentence or less, and then I just have a couple more words to say. Laura, I'll start with you.
Don't start with me. I'm going to steal Melinda's. Counseling and therapy is a requirement for the human condition. It's really okay to ask for help. Physical wellness, emotional wellness, it's all one and the same. We're here for you.
Thank you. Rochelle.
And I just wanted to say thank you so much for having this space and inviting us here to be a part of. And just remember that you matter. You matter, your family matters, your thoughts matter, everything. You're here on this earth for whatever you believe and whatever your purpose, but you matter. And so we really appreciate that you joined us today here and go to the website, go to Crisis Services website, go to all of the websites and see how you can get yourself. You can do that behind the scenes where if you're a little afraid right now or you're not trusting, and you can do that behind the scenes to find out where to go and get you some help. I'm talking about everyone, including us, who's on here, from the emergency responders all the way down to any consumers, that you matter. And we want to validate you, and we want to be able to be here for you. So please take that and do some research for some things that you need in your life. If it's counseling or peer groups, we're here for you. You matter.
Melinda, I'm sorry. Laura asked for one more second.
So there is help, there is hope. And that's, my summary of Rochelle's statement.
Yes. And I think I can just end with the same thing. The more we talk about our struggles, the more we give other opportunities for other people to share their struggles. So from, the Anti-Stigma Coalition, the best way to decrease stigma is by talking about what's happening in your life and the struggles that you're having. The more we do that, the more opportunities we give for other people to share their struggles.
I knew this was going to be a great conversation, and got to be honest with you, the three of you were just amazing. Thank you so much. You made this easy on me. Got to be honest with you. So thank you very, very, very much. As a reminder to our audience, we need you to take the pledge to end stigma by going to our website, letstalkstigma.org. If your organization would like to join us in our cause, there's information on the website as well. Just click on the Members tab to find out how. Together, we can reduce stigma and create an environment of support where help seeking and help giving are the norm. Once again, I'd like to thank our panelists, Melinda DuBois, Laura Kelemen, and Rochelle Morrison. Thank you, ladies. Oh, just fantastic conversation today. I'd like to thank everyone behind the scenes as well. Mike Telesco from Telesco Creative Group for his vision and technical support, Carol Doggett from the Mental Health Advocates of Western New York, and Karen Karaszewski from KKPR Buffalo for their support as well. On behalf of the Erie County Anti-Stigma Coalition, until next time, I'm Frank Cammarata. Stand up to stigma, and good luck on your wellness journey. Thanks again.
Thank you.
Thank you.